Good evening. My name is Candy Pringle, and I am a student at the University of Arizona Global Campus. I am studying Health and Human Services. Today, I want to bring a presentation to you surrounding the subject of telehealth. Now, telehealth is the use of a phone, computer, or tablet to remotely have health related services by use of these telecommunication devices. The patient schedules an appointment to see their physician, and services are rendered by either a video conference or over the phone. Since the onset of COVID 19, the pandemic in 2020, many patients were not able to go into their actual physician's offices for appointments. The virtual appointments were necessary for those in need of care due to multiple closures of offices in their communities and those closures that were related to the pandemic. Now, in an attempt to ensure access to care, many providers introduce their patients to telehealth services. By increasing access to physicians and specialists, telehealth ensures that patients receive the right care at the right place at the right time. Now, ethically and legally, there are some potential challenges to telehealth services in terms of privacy and continuity of care. According to the American Psychological Association, they must further assure themselves that the telemedicine services they work with have appropriate protocols to prevent unauthorized access and to protect the security and integrity of patient information. Now, the provider must also know the difference as to when it's appropriate to utilize telehealth services as opposed to having the patient to come into their office. As we know, some services are fine for telehealth, but then there are other times in which the patient must be physically evaluated by the provider. Misdiagnosis could lead to legal ramifications, and for this reason, providers and staff must have suitable training. Providers must be careful not to commit fraud in terms of billing for services that were not rendered during the telehealth visit. Now, I personally have nothing but positive things to say about telehealth. Being one of the patients who have an underlying condition, um, that could make me susceptible to COVID 19, and it's very important that I remain healthy for myself as well as my family. The convenience of telehealth helps me to get the care that I need from my physician for chronic conditions. Prior to my mother passing away in December of 2020 due to COVID 19, it was acceptable to be able to have a teleconference visit with not only my mother but her providers in terms of her care and how it related to her situation. Having an iPad available just made all the difference in the world. Now, as I work in the healthcare insurance industry, I've watched many employers, many of the employer groups, they made a decision to allow their employees to have telehealth services at no cost. Now, these telehealth services were for behavioral health, for regular office visits, as well as any COVID related telehealth services. And this decision was very important because it helped those who were financially impacted by the pandemic. Telehealth is expected to change the trajectory of healthcare delivery in terms of patients' access to care, which is a great thing. Globally, telehealth can change the delivery of care for countries that struggle with economic advancement. According to the Journal of Global Health, developing nations can also leverage telemedicine to improve weak public health systems that are under cost constraints. As a teaching tool, telemedicine may be beneficial in the education of nurses and physicians globally in those countries that lack resources to financially update technology. As a global community working daily to resolve social and economic issues, it's imperative that we also work together to ensure that healthcare is accessible to all at a cost that everyone can afford. The future of our children, the elderly, women's health services, behavioral health, physical therapies, and educational services are relying on the advancement of technologies that support telehealth. Billing practices, privacy adherence, and compliance are all services that can be enhanced through the research related to telehealth. In conclusion, and as we look forward to eradicating the COVID 19 pandemic, I believe that telehealth will be vital to the future of healthcare. In the past year, most of us have experienced something like never before. With research involving scientists, information technology, and practitioners, I expect to see many advances. As a health and human services professional, I am hopeful that the data will assist to make internet accessible to everyone and healthcare accessible to all. Thank you so much for joining me. I certainly appreciate the time that you've spent to listen to my presentation on telehealth. Thank you.